Hi guys, today is our topic that is we will see about important disorder that comes under the neuromuscular junctions disease. Here this neuromuscular junction disorders. Okay, here in neuromuscular junctions disorders, there are many disorders. One of the important disorders that is Myasthenia Gravis. Okay, it is a neuromuscular disorder. Next, we will see in detail about how the neuromuscular junctions it is. Okay, actually, how is the neuromuscular junction it is? Okay, let's see here. Let's suppose this is our spinal cord. See this. Now, this is our motor neuron. From this motor neuron, there is electrical impulses are generated. Now, these impulses, that is, this is called nerve. Here it is nerve, and by this nerve, there is a action potential generated. Okay. Now, this is a motor neuron. From this motor neuron, this is presynaptic nerve, and in this presynaptic nerve, the actual uh, changes we will see. Okay, it is a normal physiology. First, we can see in the neuromuscular junction. After that, what are the disorder? What are the clinical changes that we can see in this scenario or in this disease? Okay, let's see here. This is a presynaptic nerve, and it is that is postsynaptic nerve. This postsynaptic nerve, it is known as, yes, it is a muscle fiber. Okay, it is a muscle fiber. Here in this this is a presynaptic nerve, and this presynaptic nerve ending, and the space between the presynaptic and synaptic nerve, it is known as synaptic cleft. Okay, here in the presynaptic nerve, first there is a uh, acetyl acetylcholine is produced in this packet. How the acetylcholine is produced? There is a uptake of this acetylcholine from the digestive system. The choline is taken up this digestive system and goes to the presynaptic nerve. In this presynaptic nerve, there is a mitochondria. These mitochondria they release a acetate or acetyl-CoA, and this acetyl-CoA combine with choline and form acetylcholine. Okay, and they form acetylcholine. This acetylcholine again further undergo in the acetylcholine, and here some of the sodium channels are there on the surface of the nerve ending. When there is a sodium influx, the sodium influx, these sodium influx uh, leads to the increased potential or increase positive charge in the nerve, and that leads to the voltage sensitive calcium channel open. Okay, voltage sensitive or voltage gated calcium channels will open. Voltage gated calcium channels will open, and there is a influx of calcium. There is a influx of calcium, and this acetylcholine has a special receptor or special protein on this vesicle. This protein is called synaptobrevin. This protein is known as synaptobrevin. Let me write here. synapto synaptobrevin synaptobrevin, and on the presynaptic membrane there is again special protein. This protein is called synapto sorry syntaxins. Okay, this protein is called syntaxins. On this protein there is a two structure. These structures are close, and there is whenever there is an influx of calcium, these proteins or the T is closed, this protein is open like this. When there is a influx of calcium in this protein, okay, it is formed like this, and this due to calcium influx, calciums are bind on these receptor. Now there is a site for this synaptobrevin. This synaptobrevin will bind to this protein, and after that this protein will pull this membrane of this acetylcholine vesicle, and there is a exocytosis of this acetylcholine. Okay, exocytosis of acetylcholine, and there is a release of acetylcholine in the synaptic space. Okay, there is a release of acetylcholine in the synaptic space. Okay, how it is occur, let's see again. Yes, let's say again, there is recap. First there is a motor nerve. When there is a motor nerve stimulate, there is a depolarization of this motor nerve due to there is a increased sodium influx. When there is a increased sodium influx in this nerve, there is a depolarization wave will occur, and at the last, at the presynaptic membrane, when there is a depolarization of the nerve, there is a sensitive or voltage sensitive calcium channel, or you can say voltage gated calcium channels will open, and that can influx the calcium. Okay, and there is a packets of acetylcholine at formed in the presynaptic membrane by the acetylcholine is taken up by this digestive system, and goes to the presynaptic nerve, and there is a mitochondria present in the presynaptic nerve that release the acetyl-CoA, that choline combine with acetylcholine to form a acetyl-CoA to form a acetylcholine neurotransmitter that is formed in the packets, and this vesicle has a special protein that is called synaptobrevin. This synaptobrevin has it is a protein that binds the syntaxins. The syntaxins has the closed mouth that is closed opened by this calcium. This calcium opens the mouth of this syntaxins, and these receptors, synaptobrevin receptors, bind to this protein, and this syntaxins pull this synaptobrevin, and the vesicles is when the protein is removed, then there is a vesicles that exocytosis, and the exocytosis, this acetylcholine release in the synaptic cleft. Okay, this is all about the release of acetylcholine. Okay, now here, now again the story is there. Yes, now again here the acetylcholine is there on the crest of this muscle. It is a muscle fiber, or it is sarcolemma of the muscle. These are the crest. Okay, these are the crest. These on this crest there is a special receptor. This receptor is known as acetylcholine binding receptor. Acetylcholine binding receptor. Okay, acetylcholine binding receptor. This receptor will take and magnify here. Okay, this receptor is like this. It has a pentavalent, and this pentavalent protein has two phase. On these two phase there is a binding of this acetylcholine binding of this acetylcholine. Let me see, tell it is acetylcholine that is bind in this receptor. When there is a binding of this acetylcholine to this receptor, there is a increase or most of the sodium influx. Sodium, not only sodium, there is a cation influx in this sarcolemma, and the resting membrane potential of this muscle is minus 90 millivolt. When there is a cation influx, this leads to the less negative, that is minus 80 millivolt, minus 70 millivolt, and there is a at last that makes the end plate potential. This end plate potential goes through the threshold potential, and this threshold potential leads to the what leads to the stimulation of uh, sodium gated or voltage gated sodium channel will open, and there is a more influx of sodium again in the muscle fiber, and there is a more sodium influx in this muscle fiber, and that lead to the contraction of the muscle. Okay, this is all about the nerve physiology. Now we will see the disorders related to this. Okay, one thing we will see before going to this disorders. One thing is the whenever there is a contraction of this muscle, that should be release. Okay, that should be release. It means if there is a contraction, we cannot contract it lightly, we have to release. It means this acetylcholine has to be removed or has to be destroyed. Okay, here this acetylcholine removed or destroyed by a special enzyme that is present here. This enzyme this enzyme is a scissor like that uh, cut the or destroy this acetylcholine. Okay, okay, now we will see the neuromuscular disorders. Here these neuromuscular disorders are, first is autoimmune disorders. In that there is two disorders. First there is a myasthenia gravis and Leber's Eaton's myasthenic syndrome. These